Welcome to the Senior Focus. I'm your host, Attorney Nick Kaltzis. Have with me Dr. Christopher Vinton today, Robert Dwyer, the Executive Director of the Central Massachusetts Agency on Aging, and of course, Donna Osterguy.
Hello, Nick.
You know what they say, knowledge is power.
They do say that.
The more that someone knows about a topic, the more helpful it is for them. And today, we're going to talk about arthritis. Did you know that 50 million Americans suffer from some form of arthritic condition, and there's been an explosion in joint replacement surgery? So I thought, what better way to inform people than to have a physician on that does these joint replacement surgeries and techniques. And Dr. Vinton,
Thank you.
thank you for coming in today.
Thanks for having me.
I wanted to find out a little bit about how long you've been a physician, if there was anything in particular that got you interested in medicine, that kind of thing.
Sure. I actually originally came up to Worcester via Holy Cross, went there as an undergrad, played sports there and got into orthopedics, shadowing my now partner, Dr. Leahy. Spent time at Dartmouth Medical School and then back to UMass for residency, and did my general orthopedics there. Did a sports fellowship at Brigham and Women's Hospital in Boston and finished up there in 2007 and joined Dr. Leahy in practice. So I've been in practice in Worcester now for about 5 years. And in terms of what got me involved in orthopedics, originally it was more the sports side of things, addressing people with injuries, bringing them back to their previous state of health, and got more interested in joint replacements a little bit later through the residency.
So you mentioned that you did undergrad at Holy Cross.
I did.
Did you ever have a class with Robert Dwyer?
I probably did not. I was a biology major and took the bare necessities outside of my
So unless you
major.
took gerontology, no.
Gerontology is a very important topic as well. The population is aging at, I don't want to say an alarming rate, but at a very accelerated rate. And I would presume that a lot of orthopedic issues that you see delve from the fact that as a person ages, their body begins to break down.
Yeah, true, and that's primarily what osteoarthritis is. It's it's wear and tear, kind of aging arthritis, and as we see the baby boomer population come through, joint replacements are just expected to skyrocket over the next decade.
So when you say osteoarthritis, what exactly is that?
So and we were talking about this a little bit earlier, that there's two major kind of arthritises. There's the inflammatory arthritis, which would be rheumatoid, psoriatic, lupus, and that's more of a autoimmune disease where the body's immune system kind of reacts against its own tissue and joint and causes inflammation and destruction within the joints. And then there's osteoarthritis, which is primarily it's a breakdown and loss of the normal joint cartilage that protects the joints, and as that cartilage wears, you get swelling, inflammation, and deformity within the joint, and pain, of course, that goes along with that.
As a person ages, are they more susceptible to one kind of arthritis as opposed to another kind of arthritis? Or?
Typically, the inflammatory arthritises will hit you a little bit younger in life, in your 20s and 40s, and the osteoarthritis is more prevalent in the 60s and above. Certainly, pre-existing trauma, injury, significant fractures, or especially around the joint, can predispose you to post-traumatic, osteoarthritis or degenerative arthritis.
Okay. And as far as joint replacement, is it more prevalent in one kind of arthritis as opposed to another kind of arthritis, or does it not matter?
Well, the end result of any one of these processes is a significantly degenerated joint where you're essentially bone on bone. You've lost all the cartilage and joint support. And either pathway, inflammatory or non-inflammatory.
Sounds painful.
It is painful, and people sort of suffer with it for a long time before they get to the point of joint replacement. But ultimately, you end up at the same point, and joint replacement's a good option in terms of treatment.
In your practice, have you seen a I don't know if I want to say a vast increase, but an increase in people that are eligible for joint replacement?
Definitely. You know, I've only been in practice for 5 years, so I wouldn't say that the overall scope of patients has changed a whole lot in the last 5 years. But as I've you know, done more and more joint replacements and starting to become known for some of the procedures, I think that part of my practice is definitely picking up.
Okay. We are having a symposium
We are.
on living well with arthritis and joint replacement.
We are, and we're very fortunate to have Dr. Christopher Vinton as our keynote speaker, and I know that there's a specific area that we're going to touch on Tuesday, September 18th. I want to mention that if anybody would like to attend our event, you can call our office, 508-755-6525, or visit our website, theseniorfocus.com, to register for this. And we're very thankful, Dr. Vinton, that you've decided to hop on board and be part of this great event. And I know that there's many, many people, we've had a lot of people recently signing up who are not, I'll say, even of elderly age, in their 50s, who may be athletic, have broken bones in the past, and want to find out the newest, greatest, latest advancements in joint replacement. And I know that you're going to be speaking on a newer area, we'll say,
Right.
on joint replacement.
You know, before we continue, what I did want people to understand is that, you know, the numbers of people that have registered for the event, I think we're at like 170 now, and we're being told that, you know, although you might have some space left, the space is filling up rather quickly.
Quickly.
So in the event someone, you know, is interested in obtaining more information on arthritis, the number to call again?
508-755-6525. So I wanted to ask you specifically, when you give your keynote address, what is it that you'll be speaking on that day?
Well, primarily I'll be speaking on hip replacement, and you know, there's a lot of advances that have been made in terms of how you fix the implants to the bone, some of the bearing surfaces, you know, what the ball and the socket are made out of, and I'll kind of touch on some of those. But one of the primary focuses will be on the anterior approach and how it differs from some of the other approaches out there.
And with the anterior approach, would you say that where it differs from the other, is it something that we'll say, where most people look at hip replace or any joint replacement as a painful procedure, no matter what you're looking at, I'll say extensive rehab. My mother has knee replacement surgery 15 years ago, and luckily it worked perfect for her. However, there are some people that we've even had clients who have come in and said, it just didn't work, I have to go for it again, or something didn't work within that procedure. That's really scary for someone approaching this and saying, are there new advancements? Are there ways that will say less painful, quicker recovery time? And do you see this with this new approach?
Definitely, you know, but getting back to the hip replacement as a whole, you know, hip replacement is probably the best surgery that we do as orthopedic surgeons in terms of sort of predictability of, you know, return of function, pain relief. So it's already a great surgery and really improves quality of life. The anterior approach has shortened the rehab in ways, has made it an easier you know, procedure to go through. There's less post-operative precautions that you have to go through, and people are definitely recovering faster.
The one thing that you oftentimes hear, or at least that I've oftentimes heard from people, is that their physicians tell them, you know, not yet. Don't go for the replacement surgery. Delay it until you're, you know, older in age, and you know, that way it'll last, you know, for a particular long period of time as you age.
Right.
Does that make sense?
I mean, in ways that is good advice. You know, the risk of doing it younger in life is that you're going to have to revise it or do it again later in life. And clearly the success rate with the first time hip replacement versus a revision hip replacement, it's much better the first time around.
Right.
So you do want to put it off until you have to do it, and the longer you put it off, the better. Now, realistically, if you have someone in their 50s with end-stage arthritis, to change their likelihood of revision, you'd pretty much have to tell them to put the surgery off for 15 to 20 years. You know.
What is end-stage arthritis?
So end-stage would be bone on bone. You know, you've worn out all the cartilage. There's nothing left.
Right, okay.
And if you're at that point in your 50s, you know,
got to do what you have to do.
You're making the choice of doing the hip replacement in your 50s and accepting that you'll potentially have to revise it. Or if you're going to put it off, it's not putting it off 1 to 2 years. It's putting it off 10 to 15 years. And for many people, that's unreasonable. You
I
know?
would think that affects their quality of life and being able
It
to do
does.
what they want
Right.
to do.
It's a conversation I have with patients all the time, and at the end, most people say, I would much rather have 15, 20, however
Good
many
years.
good years
Right.
in my 50s and 60s, and I will, if I have to revise it, I'll revise it and deal with it at that point.
As far as maintaining quality of life at Central Mass Agency on Aging, that's what your mission is, to try to help the senior population or those with disabilities maintain their quality of life.
Absolutely. As you said at the very beginning, knowledge is power.
It is.
And the fact is, what we try to do at CMAA is offer the information to empower people. So give them the knowledge that they need to be able to find physicians such as Dr. Vinton, programs such as there are at the orthopedic specialists at St. V's or at UMass, to be sure that they have the best possible opportunities, that they can access those things.
Do you find that people call in with orthopedic issues with more frequency than before as the population ages?
I think what we're finding is the caregivers calling in more about it.
Okay.
Because they're noticing that the parent may be having a problem walking. They're noticed that that's a possibility of a fall, this, that, and the other thing. So they're more curious about what programs are available, what types of opportunities there are for their parent or their aunt, their uncle, or their spouse, to be able to better their quality of life. Because it may not be an issue with other types of illnesses. It may simply be or solely be that orthopedic issue that is cropping up, that now they're afraid to walk. They're afraid to go out of the house. They're afraid to fall. And so how do you rectify those? And yes, you can do a fall safe program to start with them. You can have their home assessed. But if they're having certain pain, if they feel wobbly on their feet, they need to see a specialist.
You mentioned fall prevention and people falling. I'm not quite certain if it's still the case, but I can remember that if a person, were elderly and fell and broke a bone, was a really, really bad thing.
Yeah.
So
Still the case.
Okay.
It's a major impact on their mobility. Most people will at least slip one functional level. So if you were on a cane, most likely you're on a walker. If you were sort of on a walker, not doing a lot of ambulating, you may end up in a wheelchair. And there's serious health consequences, at a year out from
why
a
is
fracture.
it that when a person ages and they sustain an injury like this, a break, that I presume they just don't heal well?
Well,
Is that what it
the
is?
bone heals,
Okay.
but it's usually their, other medical problems, the reasons that cause them to fall in the first place, and a lot of times they're kind of right on the edge, and then the fall puts them over the edge.
And I presume that after they have, we'll say, a surgical intervention, there are other modes of treatment that they can undergo thereafter?
Certainly, fixing the fracture or replacing the hip, doing something to address the hip fracture is just part of it, and there's a lot of physical therapy and rehab that really goes into it.
We're going to talk about all of these arthritic conditions and orthopedic issues at the symposium. Tuesday, September 18th, starts at 9 in the morning. Actual registration begins
8:30?
even before. The speakers begin promptly at 9 o'clock, so I suppose that means that you begin promptly at 9 o'clock.
I'll be on
am.
time.
Yeah, that's good. We're going to head to a break right now, and when we come back, we're going to talk to Dr. Vinton and Bob Dwyer and Don Ossegay more about the symposium.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Join us Tuesday, September 18th at Holy Cross College's Hogan Center for a free symposium open to the public, Living Well with Arthritis and Joint Replacement. There will be a free buffet lunch, free parking, raffle prizes, and more. To register, call 508-755-6525. Register online at theseniorfocus.com. Presented by The Senior Focus with attorney Nick Kalsis.
This is Virgil Gibson. Join me at the Hanover Theater on October 13th for a great night of music and comedy to benefit St. John's Food for the Poor. Buy your ticket and help close the funding gap so construction can start on Worcester's new St. John's Food for the Poor Center. Purchase your ticket now by calling 877-571-7469.
Tired of weather reports that don't focus on Central Mass? Introducing Worcester Weather, the only video weather report for Worcester. Worcester Weather is easily accessible 24/7 by visiting chartertv3.com. It is updated throughout the day to give you the best video forecast possible. Worcester Weather also airs at 5 p.m. during the Jordan Levy Show and every Worcester News Tonight telecast. Worcester Weather gives you the local forecast you have always wanted. Worcester Weather on Charter TV3 and chartertv3.com. Brought to you by Berterra Nissan of Auburn. Charter TV3 and UMass Memorial Healthcare have teamed up to bring you the latest news and trends in healthcare. Health Watch, presented by UMass Memorial Healthcare, brings you the healthcare topics that are important to you. From stroke prevention to allergies, skincare to sports injury prevention, and nutrition to pregnancy, Health Watch and UMass Memorial Healthcare informs you on the issues that affect you on a daily basis. Health Watch on Charter TV3. For extended interviews with UMass Memorial Healthcare experts, log on to our website.
I'm Kristen Doucette from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, attorney Nick Kalsis. I'm here with Dr. Christopher Vinton, Robert Dwyer, and Donna Ostagai, and we're talking about arthritis and orthopedic issues and the Living Well with Arthritis
and Joint Replacement Symposium. I want to encourage all of our viewers to please go to our website at www.theseniorfocus.com or call our office 508-755-6525. There's still opportunities for you to attend. We still have seats available, probably about 25 more seats. I think about 200's the cap, and we're getting there very, very quickly.
25 seats will go in a day
So
or two.
quickly.
So in the event someone has any interest in obtaining information with respect to arthritis,
You'd want to call our office.
Yeah,
I want to
don't
tell
delay.
you, the day itself, we're very excited about this. We have Dr. Christopher Vinton as our keynote speaker. We also have Dr. William Balcom, Dr. Julie Levingood, Dr. Anthony Rivera, Kushnam Narawala, who is a physical therapist who works with joint replacement all the time and arthritis to help people in that way. And we also have you, Nick.
you do.
We do. Quickly, though. 5 or 10 minutes.
5
You're
or
in a
10
rush all the
minutes.
time at these events.
Well, 5 or
He
10
doesn't
minutes
like to
will
speak
get the
too
job
long.
done.
That's right.
Yeah.
So we encourage you to please attend. There's free parking, free lunch, and free gift raffles. It's all at Holy Cross College, which is so easily accessible. And again, please feel free to call our office. It's from 9 to 3. Then phone number one more time, 508-755-6525.
You know, I think that the day is focused on medical approaches, not only for arthritis, but, like we said, for
Joint
joint
replacement.
replacement. And I'd like to feature the speakers that you mentioned, and, it might be helpful for them to find out about the Be Prepared, Be Organized kit and talk a little bit about it. But I prefer to let the information out there from the doctors about arthritis and joint replacement.
I think that the most important factor for these symposia is that people are able to go and find out we'll say not only the latest and greatest advancements, but also hear from all different types, whether it be a physical therapist, where sometimes people are nervous of that. They're thinking to themselves after a surgery, gosh, I don't know if I want to have to deal with the pain, or they don't realize the importance of physical therapy and how great a role it plays in getting better. I know my mom's surgery, she had knee replacement 15 years ago, and I actually had to leave the room the first 2 times that I was with her for that. It was really hard to watch, but she was able to golf for at least 20 years now of being able to still golf up till she was 84 years old, which she loved, and she had to stop that because of it. So I mean, they've advanced it so far. I know years ago, I don't even know if they had that. How long is in existence has joint replacement been? Is it a long time?
Yeah, I mean, the first hip probably went in the 70s. You know,
Wow. Yeah, but it's come so far.
It's come a long way.
And we were just discussing during the break, Dr. Vinton, how it's actually less pain, and you would think with a hip, it's much more difficult, a bigger space at least, that you're having to fill, and yet it's less pain, you were saying, than
typically the hip replacement patients have an easier recovery, a little less painful, less therapy dependent. I mean, you do need to do your therapy, but total knees are probably a little harder to rehab.
You know, my wife had a total knee, and it isn't so much the joint. The knee has been replaced. It's not her knee. It's like a metal device, but the surrounding tissues, the musculature hurts. And it's been like a year.
Right. Very typical.
Yeah. I mean, she's getting better, but it's a slow process.
It is.
You know, I think that when you look at the extent of the pain that she was in prior to the replacement, it was worth it. It's a different kind of pain, a different nature, but it isn't something that, you know, someone should expect that they get it done and 2 weeks later they're out on the golf course. It isn't going to work that way.
Correct. No, it takes a lot on the other end of surgery to recover your function.
And I think so important on the other end of the surgery in terms of the PT is for people to remember that if they don't get up and move around, they become more susceptible to other processes, such as pneumonia, such as various other things that can happen. And that's what happened. I remember when I was a kid, if an older person broke their hip, well, that was almost the death sentence right there, because they couldn't get up. There was no replacement. They couldn't get up. They couldn't move. And so they would get pneumonia or something else and then pass away because they weren't able to get up and do that physical therapy.
I think that's one of the things that you'll say to someone when you give them a knee replacement is that they've got to move that knee.
It's the number one thing we say, you know, before surgery, after surgery, because that's the one thing that is really time dependent right after surgery. You have to start moving it. You have to move it right away, or else you can get stiff.
Now, I think that during the break, Bob was asking you about
osteoporosis.
Okay.
And I know that, of course, there's so many things being advertised now to prevent osteoporosis. It is something that a lot of us do think about, bone density tests for older women, etc. Is there a relationship between osteoporosis and arthritis? Does one prevent, for example, if you have osteoporosis, would that prevent a replacement?
So it's a good question, and patients frequently are confused as to the difference between the two. Osteoporosis is a decrease in bone mineral density. Osteoporosis puts you at risk for fragility fractures, hip fractures, wrist fractures, spine compression fractures, from a low energy injury, fall from a standing position. Whereas osteoarthritis is a degeneration of the joint and the cartilage. They are not mutually exclusive. Frequently, you don't see a lot of osteoporosis with osteoarthritis. Patients with osteoarthritis typically have pretty good bone density, but you can definitely see elderly patients that have both osteoarthritis and osteoporosis. Osteoporosis changes maybe some of the ways that you would approach a joint replacement, but it doesn't mean you can't have one. So it's still an option.
So even though there might be a weakened bone, that doesn't mean that you can't have that joint replaced.
Correct. It means that you may have to change how you fix the implants to the bone. It may change your choice of implants. May change your recovery and your rehab protocols a little bit, but joint replacement is still an option.
Good. Very nice.
Now, with respect to exercise, every physician I've ever spoken to about any topic has always touted the benefits of exercise, and I bet you're going to do the exact same thing right now.
Absolutely. We hit our peak bone mineral density, or our bones are as dense and strong as they're going to be in mid to late 20s, and you start losing density.
How does that happen?
It's just the way it is.
Okay.
You just
Okay.
your body starts losing, hormonal changes, everything. You start losing density in your bones, and so the goal is to slow that as much as possible and make that decline as flat as possible. Making sure you're getting appropriate calcium, vitamin D, and weight-bearing exercise is the #1 thing for keeping your bones strong and healthy.
Now, as far as the nutritional treatment or value, what kind of foods might a senior eat to get an adequate amount of calcium and other vitamins and minerals?
Most of the dairy products have high calcium in them. Milks are going to usually be fortified with vitamin D. There's a lot of supplements. A lot of people take over-the-counter nutritional supplements. You have to be a little bit careful with those and make sure they, are compatible with the other medications that you're on. So usually we'll have the primary care physicians really go through patient's med list and make sure.
Wasn't there a problem with the Meals on Wheels program and having milk included? I know that there isn't a problem now, but at one point, wasn't federal funding a little bit tight for that, or?
I think the issue was, where was the milk coming from?
Okay.
And the whole aspect of the mad cow disease
Yep.
and what that all meant, that's pretty well dissipated at this point. And milk is definitely included. It might be sometimes a low-fat milk, depending upon the dietary needs of the person who receives it. But every Meals on Wheels or every meal that's given in the senior center or other community center through the Title III program that we support is 1/3 of the daily nutritional expectations of the FDA.
So it's a nutritionally balanced meal, includes milk, which Dr. Vinton is saying, you're able to get your calcium and other vitamin and mineral intake that you need to maintain, or at least attempt to maintain, the density of your bone structure. It's really a very important program.
It is. It's very important, and it does follow, as I said, it follows that pyramid that the FDA puts out. So it's 1/3 of what you need. If you have a special dietary need, whether you need less salt or less sugar, if it's a diabetic meal, for example, or if it's a cultural thing where you want a kosher meal, then those are available too. But it's always got to be that 1/3 of the daily requirements.
You take a look at the numbers, and we see the population, the age of the population increasing, the numbers of people that suffer from arthritic conditions and that require some kind of a joint replacement really escalating at a fairly significant rate. And then you see some problems with the Meals on Wheels program and funding issues. It's very, very important when you take a global look at the totality of the circumstances that the senior population be eligible to receive the nutrition that they require to try to hold off some of these arthritic situations.
Oh, absolutely, and especially when you're looking at the homebound population. They are the ones who are most susceptible to falls. They are the ones who are most susceptible to the other disease processes that can inflict a problem with them. So they need that nutrition. That might be the only nutritionally balanced meal they get in a day. Because we don't know if they're throwing in a Pop-Tart for breakfast or if they're going to have the Sara Lee meal or whatever it is at the end of the day. I'm sure they don't get Ben and Jerry's delivered, but I probably will try to do that myself. But the reality is that nutrition is so very, very important, and that funding is decreasing even as we speak. And if, not to get into politics too much, but if come January there's no budget deal, we are going to be really on the edge with all of the funding that helps, particularly the homebound frail elders.
We're going to be over the edge come January if there's no budget deal. But on that note, we're going to head to a break.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Join us Tuesday, September 18th at Holy Cross College's Hogan Center for a free symposium open to the public, Living Well with Arthritis and Joint Replacement. There will be a free buffet lunch, free parking, raffle prizes, and more. To register, call 508-755-6525. Register online at theseniorfocus.com. Presented by The Senior Focus with attorney Nick Kalsis.
Coverage from Central Massachusetts for Central Massachusetts.
Movers pack up the Worcester Tornadoes corporate headquarters.
Officials and the Central Mass Mosquito Control Project are implementing plans to try to help protect the
The
public.
American Red Cross has been deploying volunteers ahead of the storm to ensure safe travel. A string of fires that's plagued a Worcester neighborhood.
Reporters in the field and an in-depth local forecast. Worcester News Tonight on Charter TV3.
This is Virgil Gibson. Join me at the Hanover Theater on October 13th for a great night of music and comedy to benefit St. John's Food for the Poor. Buy your ticket and help close the funding gap so construction can start on Worcester's new St. John's Food for the Poor Center. Purchase your ticket now by calling 877-571-7469.
Ben & Cherry's is suing X-rated DVDs, hardcore pornographic films, as they're smearing their ice cream maker's reputation this night. It says some of the X-rated names are similar to its own. The names include Boston Cream Thigh, and New York Fat and Chunky, and Peanut Butter Decaf. Oh my God, help us.
I'm Siobhan Connolly from Worcester News Tonight. Thank you for choosing Charter.
Welcome back to the Senior Focus. I'm your host, Nick Kalsis. I'm here with Dr. Christopher Vinton, Robert Dwyer, and Donna Ostagai, and we're talking about arthritis, joint replacement, and the symposium that will be taking place Tuesday, September 18th. That's next Tuesday.
Next Tuesday, coming very, very quickly. We're so excited for it, actually.
And if an individual is interested in obtaining information,
They can call our office, 508-755-6525, or register through our website, www.theseniorfocus.com.
we were talking about different types of joint replacements, and we've been talking predominantly about hip replacement and knee replacements, but there are other joints that you work with as well, aren't there?
True, yeah. You know, I do hip replacement, knee replacement, shoulder replacement. My biggest population is probably hip replacement. I think the technology has really advanced, you know, in that particular area the best, and I think the durability is probably the best in that area as well.
Do you see a particular age where a replacement is required, or is it pretty much it all depends?
You know, probably the majority are going in the mid to late 60s to 70s. But yeah, I also do hip sports cases. You know, I do hip arthroscopy. I'm trained in that, and so I get a lot of patients in the sort of in-between zone where they maybe have a little arthritis, maybe had a hip injury, and are they a candidate for an arthroscopy or a scope? You know, something minimally invasive, or is it a a replacement. So my population of replacements is probably more, mid to late 40s to early 70s.
Okay.
Would you say that with the patients you see, I know that our clients, Nick, when they come in, some of them are really, we'll say, hobbling along, and they'll say, oh, I've had this bad knee for years, and I'm just getting to the point where I can hardly walk anymore. And I always encourage them, go to your doctor. If your doctor doesn't suggest it, get a second opinion, because the fact is that their quality of life is so compromised at that point. How much enjoyment is there? And I say, at least have the surgery while you're young enough. I can say with my mom's case, at 86 years old, she doesn't want to face nor think about having shoulder replacement because she's bone on bone. The issue now is that not only does she have, we'll say, the issue of the shoulder needing to be replaced, but she also has diabetes and a couple other things going on. And I think as seniors age, it seems that there's so many more things that as a physician you'd have to deal with and look at and say, is this surgery feasible? Where in their early 60s, 70s maybe, or maybe early 70s, that's probably the prime time or optimum time to do this surgery. Would you think that?
Yeah, it's hard to put an absolute number in terms of age on when the best time is, but it's a conversation you should have with your doctor. When you get to the point you're starting to give up activities that you like, that it's really starting to affect your life. If your doctor tells you you've got advanced arthritis in your joint, that's the time you want to consider it. There's plenty of patients that you see that have, like you said, have put it off almost too long, so that they've developed other problems, cardiac problems, lung problems. So it's something you should at least discuss when you find yourself giving up activities that you normally would be doing.
I can say that with my mother's knee surgery, she went from stopping golfing, and that was her passion. My dad and her did it every weekend. And the hard part is that she could no longer golf, and she finally just said, I have to do this. She went and had it done, and best thing she ever did. It probably, I'd say, maybe 8 to 10 weeks, and she was back actually golfing, which you'd never think could happen. She was in her early 70s, and yet she went right back to it and had 15 more years of great golfing, being able to golf and get out there and do what she wanted to do. And that was, the quality of life was so much improved from that. So I know that there is hope, especially for seniors who think that, gosh, I'm not mobile anymore, I can't do this, I can't do that. And yet you see the newest advancements, and how they're able to improve someone's life is so important.
Yeah.
You talk about the new advancements, and what you've been telling us is that this anterior form of replacement is more advanced than whatever the previous standard was. So I was wondering if you could define for us what the previous standard indeed was, and how the anterior form is different.
So there's many different ways of doing a joint replacement, and it's primarily the approach that you use to getting into the hip joint. There probably isn't a gold standard or a standard approach. It's sort of whatever you were trained on. All the approaches typically have a benefit and some downsides to them. Most of the folks in this area are doing a posterior approach, which is pretty standard. It's sort of an incision on the outside of the hip going back towards the buttocks, and you do have to split some muscles. You do have to take some muscles and tendons down off of the bone to do the replacement. After the replacement's done, you repair those on your way out as you close the incision. And by and large, the posterior replacement is excellent and does very well. I think the anterior offers some advantage in that the incision's in the front of the hip. It goes through a plane between two muscles, so you're not actually cutting the muscle. You're not taking any muscles down off of the bone. Once you get through that plane, you are right down on the front of the hip joint. You can open up the hip joint. You can do the replacement. At the time of doing the replacement, you're able to use X-ray. So we're using live fluoroscopy X-ray at the time, and that helps us make sure that we're putting the components in the best position, putting the cup in the right spot, and then when you're putting the stem in the femur and doing that, that part, you are able to look at how long the legs are. Do they match up in terms of the anatomy on the pelvis? So I think you get some real-time feedback in terms of really reproducing the patient's natural anatomy. It's less invasive in the sense that you're not taking the muscles down off of the bone, and I think it's a very stable replacement, because one of the complications of a replacement is dislocation. So popping the ball out of the socket. In the past, that's been up as high as 10%. With the advent of modern, implants over the last 10 years or so, it's probably dropped down to about the 1% mark. And I think it's even lower with the anterior, because you're not taking down those muscles and capsule, especially in the back of the hip joint, and those are some of the strongest prevention, or preventers of dislocation.
Great.
How do you attach the components that are necessary for a hip replacement?
Right. So the initial replacements, back in the 70s, they were cemented in place. It was a bone cement, similar to what they used to use in dental procedures. And you'd prepare the bone. You'd try and dry it off as best as possible. You put the cement in a liquid form, and you put the implant in, and then the cement hardens, similar to cement. Over the last 10 to 15 years, there's been much more of a shift towards press fit or non-cemented components, and with those, the actual hip replacement has a special sort of porous coating, almost like a sponge, and you prepare the bone to a very close tolerance, or a very tight fit to what the replacement's going to be, and then you basically just press fit the implant in, and it wedges in place, and just the initial friction holds it in place, but then your body actually grows bone into that coating on the replacement. And the nice thing about that is that with the old cement, the cement was subject to fatigue. Right. Over time, the cement could crack and fail. Whereas the biologic interface, or the bone growing into the replacement, if that gets traumatized, injured over time, your body can remodel that. It's just like any other bony surface, and your body can potentially keep that going for an indefinite period of time.
That sounds like
so
that's
far, huh?
that
They
sounds
really
like
have.
that's a tremendous
Does that
improvement.
reduce rejection?
Well, so you look at one of the ways that implants can fail is loosening. They can loosen from the bones, and there's two main kinds. There's loosening because the implant got infected, and overall infection rates are very, very low. It's less than 1%. It's probably less than 0.5%. And then there's aseptic or non-infectious loosening, so components that loosen with no reason, in terms of infection. And looking at some of the modern implants, 10-year studies looking at those, if you exclude infection as a cause of loosening, there's nearly 100% survival in terms of them not loosening.
Very good.
Yeah.
Wow, they've come so far from what they used to be. Would you say that in terms of hip replacement, even though, say that you'd have a 70-year-old person and they'd have 15 years, does it look like, I'll give you an example, my mom's 70 and she had gone to see her surgeon, and he said, she was starting to get a little bit of pain there now in her knee, and they were saying, it's still all intact, everything looks good, however, it's a 15-year ratio of when they think that possibly they may need another replacement. Do you see that happen frequently?
Well, I mean, it is something you have to do surveillance on. As a joint replacement gets up there in terms of number of years, you need to X-ray it and carefully follow the space where the plastic is. That's the part that wears out over time. Is it when we do a hip or a knee replacement, you put metal on the on the end of the ball or on the end of the knee, and there's a plastic liner that goes in between, and that's the part that can wear out. If the plastic liner wears out but the metal components haven't loosened off of the bone, it's a relatively straightforward revision. You can take out the old plastic and put in a new plastic. The thing that you're trying to prevent is for the components to loosen. So as these plastics kind of wear, they make little tiny particles, and your body kind of reacts against these particles, and in that process can eat away at the bone. So that if you catch the wear of the plastic prior to that
Early
happening,
enough.
and replace the plastic, you should be okay.
So is that full, we'll call it total knee replacement again, or can you do that arthroscopically?
No, you still have to do it as an open procedure. You still have to make the
Okay.
same incision, but you probably don't have quite as much pain because you're not doing all the bone work.
complete.
Right. And so getting to it in that window where the plastic is wearing out, but the components haven't loosened. That's the important part.
So people should actually maintain and see their doctors on a regular basis for this.
Right.
It shouldn't be just, oh, you've gotten fixed, you've got a new knee,
Right.
and then never have to worry about it for 15 years.
Right.
It's still
You
keeping
should
abreast
be-
of it and making
yeah.
sure, like any disease, you want to keep abreast of it.
Right.
It's the same exact thing. Isn't that interesting to know?
I think you wouldn't really have to, take a look at or follow it for a number of years, though. You have your procedure, you replace the joint, and if the expectancy is, 15 years, 20 years, I wouldn't think have to follow it religiously for each year.
Is that the
20
typical
years,
time
but-
frame too? 15 years, would
Well,
you say? or?
so the replacements that went in the 70s, that's what we have the long-term data on,
Right.
and those ones were maybe 90% something survival at about 15 years or so. So still the vast majority are working at that point. The big advances have been on the bearing surfaces, so the parts that are rubbing against each other. And in the hip, it's using smoother balls. So in terms of the metal ball being smoother, or alternative bearings like using a ceramic femoral head, so something that's even smoother than the metal. And then the other big advance is the advent of treated polyethylene. So the plastic in the past has been relatively soft and subject to wear. They're now treating it with various different means of radiation or some other heating treatments that can make the plastic more durable. And there's a lot of studies looking at these in the lab with wear simulators. So they subject the replacements to a whole bunch of cycles like you'd expect for walking, and you look at how much they wear. And the wear rates are significantly lower than they were against the original polyethylene.
We're going to head to a break right now, but when we come back from the break, on the other side of the break, I would like to talk about what a person's anticipated recovery would be like after one of these replacements.
Millbury Healthcare Center is a highly respected 5-star deficiency-free skilled nursing and rehabilitation center. We are renowned for our compassionate care and specialty programming, making it possible for your next step, returning home. We listen and take the time to understand your goals. We provide support and the tools needed to safely prepare for your transition home. Millbury Healthcare Center is the community choice for skilled nursing and rehabilitation.
Does your loved one suffer from memory impairment, dementia, or Alzheimer's disease? Consider Dodge Park Rest Home in Worcester. Our geriatric medical team and nursing staff are available 24 hours a day. We offer medication administration and incontinence care with dignity. Our activity programs are designed to engage and stimulate the mind. And with Dodge Park Rest Home, you can better protect your estate and save your assets with only a 1-year look back. Your loved one will feel safe and at home with Dodge Park Rest Home of Worcester.
Join us Tuesday, September 18th at Holy Cross College's Hogan Center for a free symposium open to the public, Living Well with Arthritis and Joint Replacement. There will be a free buffet lunch, free parking, raffle prizes, and more. To register, call 508-755-6525. Register online at theseniorfocus.com. Presented by The Senior Focus with attorney Nick Kalsis.
Charter TV3 and UMass Memorial Healthcare have teamed up to bring you the latest news and trends in healthcare. Health Watch, presented by UMass Memorial Healthcare, brings you the healthcare topics that are important to you. From stroke prevention to allergies, skin care to sports injury prevention, and nutrition to pregnancy, Health Watch and UMass Memorial Healthcare informed you on the issues that affect you on a daily basis. Health Watch on Charter TV3. For extended interviews with UMass Memorial Healthcare experts, log on to our website.
I'm Lieutenant Governor Tim Murray, and I'm proud to partner with Charter Communications with our pledge to help raise awareness that bullying should not be tolerated. From local school students, here is our message.
Bullies are not cool, they're just cruel. Be the change you wish to see in the world.
We need to foster safe environments for students in their schools and communities. Join the anti-bully crusade and take a stand to lend a hand. Don't be a bully.
presented by the law offices of Joseph J. Kirklia.
Join me on the Hank Stoltz Experience. You know, people are always asking me, what is the experience? Well, that's the beauty of it. It's everything that has to do with Central Massachusetts, from the politics of the region to the great events that are going on each and every weekend or every night right here in Central Mass. It's everything that's going on. It's everything that you want to know about. And just like Kelly Square, where the traffic never stops, we never stop either. There's no red lights on the Hank Stoltz Experience, only on Charter TV 3.
I'm WTAG's Jordan Levy. Join me on the Jordan Levy Show weekday afternoons on Charter TV 3. And thank you for choosing Charter.
Welcome back to the Senior Focus. I'm Nick Coltis, your host. I'm here with Dr. Christopher Vinton, Robert Dwyer, and Donna Osagai. And one of the things that I did want to ask you about is what a person's anticipated recovery would look like from one of these procedures.
Just in general, sense of the surgery, the time in the hospital. It's probably anywhere for 3 to 4 days for a typical posterior approach. The anterior approaches are maybe getting out a day earlier. By and large, we've got a lot more services set up at home these days, so probably 75–80% of patients are able to be discharged home. You'll have nursing and physical therapy at home. With the typical anterior, most people are using cane or crutches for a couple weeks. Some people are coming in at their 2 to 3 week appointment ready to get off the cane. Just about everybody's off all assistive devices by about 6 weeks. Probably takes you 2 to 3 months to make a fairly full recovery in terms of getting back to full activity. But people are going back to work, even sort of difficult jobs, 4 to 6 weeks.
And as far as a person finding out what kind of services are available in the community, there are a lot of exhibitors that do just what Dr. Vinton just said. As far as physical therapy, I believe a visiting nurse association will be there.
At our event on September 18th, next Tuesday, we have all kinds of different exhibitors who certainly community resources, everything from Central Mass Agency on Aging. Bob and his company will be there and his organization will be there to answer your questions. We have exhibitors ranging from South County Physical Therapy, the St. Vincent Hospital, Center for Musculoskeletal Services. We have Care Solutions, home health aides, home services that will come into your home like Dr. Vinton was just explaining. Instead of having to look out or maybe going to a long-term, well, we'll say a rehabilitation, although that might be the case in some cases they choose to go there, but many people are choosing to go home and want to go home to the comfort of their home. And many of these companies that will be exhibiting that day, you'll be able to go to their tables and find out more about it and find out information that they have to offer. It's a great day for everyone. It really is. Free of charge, too. It doesn't cost a thing. So we really encourage people, as you say, knowledge is power, Nick.
The big thing is it is free. It's a community service. It doesn't cost anyone anything to obtain the information, from parking to lunch to the information they receive, visiting the vendors. There isn't a charge for anything.
The raffles, everything. Everything is free.
Able to get all the information.
I look at it this way, that every person that attends walks away with more that they knew. For me, even at 50 years of age, I want to know what the future is, and not saying reading the future, but knowing that if I did have an ailment and that I needed knee replacement, well, I just had great education that day to say, wow, they have this new approach. And many of the symposia that we do, we have people who repeatedly come because they want that information. They want to know, we'll say, the latest, greatest advancements, or get to know the doctors and say, wow, he seems like a really good physician who would really take good care and knows, we'll say, the latest advancements in it. And that would be important to me as a person, to know that there's more out there. We encourage people who walk in our door all the time to get a second opinion. We say it all the time. Don't just go with that first opinion. Find out if there's something that might be better suited to you. And I'm sure even you yourself, Dr. Vinton, have referred out. We do it all the time because maybe that's not just that specific specialty. We always say when they come in, you don't go to a podiatrist for brain surgery. Right. So you have to choose what you're doing and look at it and say, say, this will help me. So we encourage all people to really attend this event. We're excited about it, free of charge. Tuesday, September 18th, Dr. Vinton's our keynote speaker, which we're so excited and happy to have.
Can we get a little sneak preview of what the keynote will be like?
It's a lot of the same topics we've been discussing today, but I'm going to really touch on the advancements in hip replacement and kind of go through that.
Sounds like the chief advancement would be an anterior approach rather than the posterior approach.
I think it's picking up in popularity. I think there's some definite advantages to it. You know, like I said, the posterior approach is still a great operation. The hip replacement in general is a great operation. But I think that, you know, that's in my experience in seeing the patients recover, I think people have been pretty happy with.
And I think not needing to affix the components with cement is also a tremendous improvement. If you can use a device where a person's bone actually affixes itself and grows into that particular device, it's got to be a great way to minimize rejection or infection. I mean, I'm not a physician, but I would think that's got to be a great help.
Yeah, durability is really key.
Correct me if I'm wrong. You were talking about what happens post-surgery, but doesn't that point to that much more importance of being as active as you possibly can before surgery to keep your muscles supple and active?
Absolutely, and just in terms of being able to recover well from the surgery, you know, your nutritional status plays a great role in how you handle the stress of a surgery, because you know, surgery is very stressful on the body, and then, you know, your muscle strength and bone strength in terms of how you rehab through the process afterwards.
Good. And I mention that because many of the organizations that will be at the symposium talk about healthy aging and what that really means. You know, this is an important component to prepare all of us who are aging to be ready to happen with whatever Dr. Vinton offers for us. You know, the healthier we are going into a surgery, the easier the recovery will be.
And we tell people all the time, it doesn't mean that you have to be a senior to attend these events. We have many caregivers. I'll give you an example. We just happened to, strange as it seems, Dr. Vinton came into my life yesterday, although not meeting him. My son dislocated his arm yesterday just by opening his shoulder, just by opening a car door, which is just really freaky to me. And I'm like, how does this happen? Oh, there must be some defect. And I think the worst. And it's common. It can happen on a regular basis. So for me, I'm like, that's strange that something so simple. That's why we say that it's not just for seniors. It's for everybody. The caregiver, the child, whoever wants to come. We had people at our Goddess Fair who were in their 20s who said, geez, I'm a runner, I've had knee problems forever. I'd love to come and hear this. So again, it's for all ages. We welcome you and encourage you to come. If you would like to attend our event, you would call our office 508-755-6525 or visit our website www.theseniorfocus.com and register. There's a button right there that you push. It'll take you right to us. And again, we're limited seating at this point. We probably have 25, maybe 30 more spots open to hear Dr. Vinton and the other great
I think those
panel of
spots are going to get
presenters.
filled up rather quickly.
Will.
So
Begins at 9 a.m. till 3 p.m. Free lunch, free parking. I'm sure that you've had plenty of lunches up at Holy Cross College, Dr. Vinton. We rave about them. We rave about them. They're wonderful.
I want to thank you for coming in today.
You're welcome.
It's very important information. You know what they say, Bob, knowledge is power. Bob, thank you for coming in
Always
today.
my pleasure, Nick.
Donna,
Thank
thank you. Join us next week for more Senior Focus.